National General Accident and Health's TrioMED, a plan for unexpected out-of-pocket costs associated with accidents, critical illness, accidental death, and dismemberment. In this video, we're going to go over the TrioMED's plan design, the eligibility behind the TrioMED, what it takes to enroll into National General's products, and all the post-sale information you will need for any questions your client may have after the product is purchased. The TrioMED is National General's guaranteed issue ancillary product. It has an accident medical expense coverage, critical illness coverage, and accidental death and dismemberment. The best part is, it is available in a large number of states. So why the additional protection? Well, there are more high deductible plans out there than ever before due to the ACA really leaving your client with a large financial gap. Employer-sponsored benefits are now shrinking, and this is great for clients who want to have the control over their health insurance costs. And what the TrioMED really does is it helps your client with the unexpected. The TrioMED has 3 coverage levels. The coverage level chosen will be both the accident medical expense and the critical illness amount. The lowest coverage option offers $2,500 worth of accident coverage, as well as $2,500 worth of critical illness coverage. The mid plan increases the accident and critical illness coverage to $5,000 each, and the highest level coverage provides a $10,000 benefit for each coverage type. For the TrioMED accident medical expense, the benefits and deductible are per injury, and there's no maximum on the number of injuries that can be claimed on a yearly basis. So if I sell a $2,500 TrioMED to a client, they sprain their ankle and the visit to the emergency room totaled around $2,500, they'll receive a check for $2,250, the benefit amount minus the deductible. The AME coverage does coordinate with the max out-of-pocket of the insured's insurance plan. So if your client's max out-of-pocket is $5,000 and you sell them a $10,000 TrioMED, the max benefit they would receive is $4,750. So the $5,000 minus the deductible. Now if they do receive any out-of-network charges, they could receive up to $9,750. If it's a short-term medical plan and the deductible is per occurrence, your client could receive up to the maximum benefit amount for every single accident that occurs. The coordination of coverage only applies to the accident medical expense portion of the TrioMED, and there are still instances where you would sell the $10,000 TrioMED benefit amount to somebody with a lower max out of pocket. Now the client must seek treatment within 30 days of covered accidents, compared to most accident medical expenses where it's 72 hours. All follow-up does have to be done within 26 weeks of the covered accident. Now let's go through a visual on how this would work. So the average cost of a hip fracture is $12,923. Let's say this hip fracture happens because of an accident. Your client's deductible is $5,000. That means the TrioMED would pay $4,750, and they would only have that deductible of $250 instead of the $5,000 deductible. There are 3 different categories of covered conditions. Now benefit amounts are paid out on a per category basis in one lump sum payment. The payouts are paid out on first diagnosis of the condition only, and the best thing is with the TrioMED, there are no waiting periods to use the critical illness benefits. Under Category 1, the plan would pay out 100% of the benefit amount you selected for heart attack, stroke, and major organ transplants defined as heart attack or combination of transplants including the heart. 25% of the benefit amount selected for coronary bypass surgery, heart valve replacement, or repair. So if the covered insured chooses a $10,000 benefit amount and they have their first ever heart valve repair, they would receive a check for $2,500. No additional payments would be made from this category, however. Now, if the covered insured had already had a heart attack prior to enrollment, this plan wouldn't pay for any heart-related claims, but they could still receive a Category 1 payout if they had their first ever stroke. Under Category 2, the plan would pay 100% of the chosen benefit amount for invasive cancer. Now, if the client is diagnosed in the first 90 days, the maximum benefit amount is 10%. They'd receive 25% payout for cancer in situ, and that's cancer that has not spread to neighboring tissue. If diagnosed in the first 90 days, the maximum benefit payout is 2.5%. Under Category 3, the plan pays 100% of the benefit amount for major organ transplants, excluding the conditions covered in Category 1, advanced Alzheimer's disease, coma, ALS, paralysis, or severe burns. For the critical illness benefits, the amount payable to the maximum benefit amount depends on what person on the plan has the critical illness. If it's the primary, you'd receive 100% of the payout, spouse is 50%, and child is 25%. The TrioMED also comes with accidental death and dismemberment benefits. Your client will receive 100% of the principal face amount if they lose both hands, the entire sight in both eyes, or speech and hearing in both ears. They would receive 50% of the principal face amount if they lose one hand and one hand or one foot and entire sight in one eye, one hand or one foot, or speech and hearing in both ears, and 25% of the face amount if they lose hearing in one ear, thumb or index finger of same hand, or all toes on the same foot. Like the critical illness benefits, it depends on what insured person has the incident happen to them on what the payout would be. Primary and spouse are 100% and child is 50%. The policy does not cover any loss caused in whole or in part by any of the following. If in the armed forces full-time, reserve or National Guard active duty for training that extends beyond 31 days, acts of war, whether declared or undeclared, if eligible for Medicare, and this Medicare exclusion only applies to the accident medical expense benefit, and it applies even if the insured is under 65 years of age. If the claim would be paid by disability or workers' comp, any intentional self-inflicted suicide or any attempt whether sane or insane, injuries while committing a felony, while intoxicated, driving without a license, flying, commercial military ultralight planes, hang gliding, parachuting, bungee jumping, use of off-road vehicles, including ATVs, rodeo participation, or engaging in motor sports, or participation in or practice for interscholastic tackle football, intercollegiate sports, semi-professional sports, or professional sports. This is not a comprehensive list of exclusions. The TrioMED does come with access to the Life Association. Your client would receive healthcare benefits like My Telemedicine, where it's free calls to a nurse practitioner or doctor that actually can diagnose and prescribe prescriptions over the phone to the local pharmacy. They just can't prescribe narcotics. They also get access to direct labs and discounts on senior medical alerts. Your client would also receive access to a fitness program, free identity theft, and a free student grant locator service, as well as entertainment services like access to travel services, retail store discounts, as well as theme park discounts. This is a map of the TrioMED state availability. All the states in yellow in front of you are where the TrioMED guaranteed issue product is available. The primary applicant and spouse at time of application must be between the ages of 18 and 64. Children can stay on the TrioMED up to age 26, and the TrioMED guaranteed issue is renewable to age 70. After age 65, the critical illness benefits are reduced by 50%. Your client can enroll into the TrioMED on either the 1st or the 15th of the month. If they are applying for coverage that wants to start on the 1st, they have to apply by the 25th. If they want coverage that starts the 15th, they must apply by the 9th. The initial payment is drawn at time of application, and the recurring payments hit 5 days before the monthly anniversary of the start date. The acceptable forms of payment are checking, savings, Visa, MasterCard, or Discover. When your client enrolls into the TrioMED, they're going to be required to complete an attestation. There are 2 ways for your client to do this. The first option is e-signature, where your client will receive an email asking them to create a VIPmemberbenefits.com account. Once they create their account and log in, they're going to be prompted to e-sign their TrioMED product. This is the easiest method. The other option is voice signature, where you'll complete a 3-way call with your client on the line, and you will be prompted a script to read verbatim. This does take about 7 minutes. E-signature is the easiest method. Once your client creates their VIPmemberbenefits.com account, they'll be able to log in and print their temporary ID cards. They'll get access to their life innovation benefits, as well as they'll have the ability to change their payment types and view all policy documents. National General has a great member services department that's here to help not only your client, but also you as an agent. During the 10-day free look period, they can help with any policy changes, as well as cancellations. The TrioMED is an exceptionally strong product to add to your portfolio. It's an accident medical expense, critical illness, accidental death, and dismemberment all in one. It has those life association benefits, has wide enrollment guidelines, There are 3 possible critical illness payouts, one from each category, has that low $250 AME deductible, as well as a guaranteed issue. If you have any questions on any National General product or how to become contracted with National General, contact training@ngisadmin.com.